Full CHIP. Thank you. Thank you, Ogai. Ogai's doing this on the fly for us. I'd first like to acknowledge that we're gathered on the ancestral and current day lands and waters of the Anishinaabe, Cree, Ojibwe Cree, Dakota, and Dene Sulini people, and on the national homeland of the Red River Métis Nation. And in northern Manitoba, we acknowledge the ancestral lands of the Inuit and gratefully acknowledge that our water is sourced from Shoal Lake 40 First Nation. And we respect the trees that were made on these lands, and we acknowledge the harms and mistakes of the past, but also the ongoing colonial violence faced by Indigenous people. And a lot of times I think when we talk about patient and public engagement, it's really important to acknowledge that it is Indigenous research methodologies that are at the forefront of engagement, and that Indigenous scholars and researchers and communities we should be looking to. And we always want to do engagement in a way that addresses social justice and equity. So today's discussion, what are we going to be looking at? We're first going to be looking at what is patient-oriented research, what is patient engagement. Then we're going to kind of explore some of the guiding principles. Sometimes it's helpful to look at what patient engagement is not, just so that we can better understand it. Then some of the core beliefs that are around patient engagement and why we should engage and some of the levels of engagement. And then we'll introduce you to some tools and resources in our next lunchtime learning series. And because we're accredited by the Royal College of Physicians and Surgeons of Canada, I will disclose that I am employed here at the Centre for Healthcare Innovation as their patient and public engagement lead. So I guess a question for everyone right now: what does patient engagement, if I say it out loud, what does it mean to you? If you want, you can respond in the chat box. Or you can unmute if you want. Or maybe we just want to think about it a little bit more as we go through, and we can always come back to that question afterwards.
I think patient engagement is understanding what they're saying, what they're going through, like what their experience is right now, and telling what I feel.
That's a great answer. Yes, understanding their lived experience and what they're going through. That's a great answer. Thanks so much. I think do we have for Mary Ann? I feel like it means talking to people with lived experience. That's right. Talking and engaging with one another. These are good answers. So I'll first start off. You guys had some great answers about patient engagement. We'll first just start off. Oh, was there another chat comment? Patients being involved in the research design and methodology development and monitoring of the implementation of research. That's a great answer too. Oh, wow. We're getting some good ones. I feel like we already have experts in the group. Seeking their feedback about the services that we offer so we can improve. That's so important from a health systems. So important. Great. So first I'll just talk a little bit about how we define patient-oriented research, and then we'll get back into patient engagement. So patient-oriented research, sometimes you'll hear that phrase. There's a national initiative here in Canada called the Strategy for Patient-Oriented Research, and it is funded by the Canadian Institutes of Health Research. So every province and territory has a support unit that's there to help researchers who want to do patient-oriented research. And so they've defined it as a continuum of research that does the following. It engages patients as partners, so actively being involved in decision-making about research. It also focuses on patient-identified priorities. It improves patient outcomes. It's typically conducted by multidisciplinary teams in partnership with relevant stakeholders. So not only will you see research teams that have people with lived and living experience, you might also have healthcare professionals, decision makers, policymakers, lots of different perspectives. And then it also aims to apply the knowledge generated to improve healthcare systems and practices. So what was mentioned, I think, in one of the chats about the importance of health systems also having people engaged. And so you might notice I sometimes capitalize or underline the and, because it's really a research continuum that encapsulates all of these pieces. Sometimes researchers might say, well, my research is patient oriented because it helps to improve patient outcomes. But really, when we talk about patient oriented research, we want to have patients who are actively engaged as partners and all of these other components as well. And then the question that I posed, what is patient engagement in health research? You all did so amazing and had so many great answers. I feel like this is going to be a repeat. But so the strategy for patient-oriented research really defines patient engagement as the meaning and active involvement of patients in the governance of research. So that's when you'll see people with lived and living experience, caregivers, and communities at the highest levels of governance of a research project. So on the operations or the steering committee. We even see in clinical trials sometimes we see people who are on the data safety monitoring board, lots of different, so having people at the highest levels of decision making, the priority setting of research. So people with lived and living experience who are actively involved in saying what should we be looking at? What should we prioritize in our research? The conducting of research. So we have many community members and patient partners who actively do things like co-facilitate focus groups, or they are co-interviewers. And what we find a lot of times is participants are more comfortable talking to a peer researcher or a patient co-researcher than other people. And then knowledge translation of research, which is a big one. So helping make sure that the findings from projects are disseminated and implemented within the system. And you might hear this, it comes from it really comes from the 1980s, both in the disability movement and the HIV community. The idea that research that is carried out with or by members of the public rather than to, about, or for them. So nothing about us without us is what we commonly hear. And then for CHI, oh, this is our lovely executive director who keeps asking me to not put this picture in my presentations, but sorry, Carly. So at CHI, we really talk about the definition of engagement really being people with lived and living experience of a health issue, including patients, informal caregivers, families, friends, and communities, having a say in decision making about the research process. What patient engagement is not. Sometimes it helps us just to get a better understanding by looking at what it is not. So patient engagement is not people being recruited to a research study or a clinical trial to take part in the research. So if you're collecting data from patients, they are seen as participants. So that wouldn't necessarily be engagement. You really want to have people with lived and living experience actively involved in decision making about the research process. People completing a questionnaire or participating in a focus group, again, as part of a research study. So if you're collecting data, it probably is an engagement. They're participants, but not partners. Science festivals open to the public with debates and discussion about research. This is always exciting, and I always encourage that researchers have ongoing dialogues with members of the public and really have that involvement. But once again, that would be a one-way engagement process where people wouldn't have the opportunity to inform research decision making. So again, it wouldn't be seen as patient engagement. An open house at a research center. We sometimes do that here. Again, it's amazing, and I want researchers to present research to the public, but because the public doesn't have a say in the research process, that wouldn't be engagement. Raising awareness of research uh, through media like television programs and newspaper, social media. Again, I highly encourage that, but it wouldn't be seen as engagement, and sharing research findings as well to participants. Oops, there we go. Some of the guiding principles and core beliefs that underlie patient engagement that you'll often hear about. First of all, inclusiveness. We really want to think about having a diversity of perspectives being engaged around decision making. So making sure that you're thinking through who has different access to healthcare systems, and how are we going to make sure that we engage these different perspectives. Support is another really important guiding principle, and that means making sure that you're meeting people where they're at. So making sure that we're compensating people for the experiential knowledge that they bring to the table, making sure that we address any potential barriers to engagement, whether it be childcare, transportation, access to technology, all of these types of things, trying to make sure that we support members, patients, community members to really be able to actively engage. And then mutual respect and partnership. This is really important. It's making sure that everyone understands the value of experiential knowledge, and that it plays an equal role in decision making as other types of knowledges around the table. Co-building is very, very important. Again, it's essential to engagement and co-learning. A lot of times what we hear from researchers is that members of the public, patients, and community need to learn more about the research process. But my big thing is that researchers and teams need to really learn about engagement and meet people where they're at. Meaning you can use different types of participatory approaches depending on the decision that members are able to contribute to, and make it more accessible. So say, for example, if you're at the phase and stage of your research process where you're looking at outcome measures and you want to know what outcome measures you should be looking at in your study that are important to people with lived experience, and say it's youth living with type 2 diabetes. Well, maybe it's having youth go out and take photographs of outcomes that are important to them, and having that conversation and using that type of participatory approach to come to decisions about what outcomes to use in your research project. So really finding ways to meet one another, meet each other where we're at. Reciprocal relationships, so important as well. This is where we think about always making sure we show we're appreciating the knowledge that comes to the table. And then transparency, honesty, and trust. Communication is one of the essentials. Ogai and Marianne are part of our wonderful PE team, and I'm sure I'm sure they would also say that communication is such an important part of engagement, being open and transparent about the process and how things work, and how people are informing research decisions all the way through the process. And the core beliefs that kind of underlie engagement. So the engagement of patients in health research will lead to improved health outcomes and an enhanced healthcare system. It will increase the quality, appropriateness, acceptability, transparency, and relevance of research. And that'll ensure that health research actually addresses issues of importance to people with lived experience of a health condition. So those are some of kind of the core beliefs that underlie engagement. One thing that we started learning along the way is that sometimes patient engagement excludes the involvement of individuals. So people who may not identify as a patient because they are unable to access healthcare systems because of geographical barriers. So for example, people living in rural and remote communities, and also systemic barriers. So people who face racism, homophobia, transphobia, ableism, xenophobia, uh, classism, sizeism, all of these different things that may impede and cause a barrier to their access to care. Also, people who may not identify as a patient because they're living with mental health or substance use issues, where taking up the label patient itself is kind of associated with stigma. And then there's also people who may refuse to engage or prematurely exit because of disrespectful or unresponsive care, or people living with a disability who are faced with continued medicalization of difference when they do enter healthcare systems. And so in this way, we really need to think about, when we are engaging, how are we going to get the multitude of diverse perspectives engaged, including individuals who may not, um, who may be excluded from other activities. And questions we often ask when we're thinking about engaging is, who is affected differently by this health issue? And that could be everything from physiologically to other differences, but also who has different access to healthcare services associated with this health issue. And that again, the geographical or systemic barriers. Where are people at in their healthcare journey? This is an important one to consider. Say, if you are engaging people with lived experience of type 2 diabetes, perhaps you want people who are newly diagnosed or people who are further along in their recovery or journey. Maybe you want a mix of different experiences. So really thinking through that as well. And then how am I going to ensure diversity of perspectives are involved in engagement? And so this comes down to really talking to people you want to engage and really finding out how they would prefer to be engaged, and then designing your strategy from there. And we've done a little bit of work around this, our Valuing All Voices framework that was made here in Manitoba. Um, so first of all, there was the discovery of the importance around incorporating trauma-informed practice when we do engagement, but also intersectional analysis. And from that, a beautiful framework was developed with community. And if you'll notice throughout this series, this monthly lunchtime learning series that we're beginning again in September, you'll see that we address a lot of these core components in the sessions that we do. So understanding and acceptance, trust, relationship building, self-awareness, education, and communication. So these are all a lot of the core foundations in building more inclusive engagement. So why should I engage? If I haven't given you enough reasons yet to engage, let's go through why we should. So first of all, to help identify research priorities that matter most to people living with health conditions, as well as their caregivers and families and communities. We've had research projects before where researchers have been convinced they know what the main priority should be, and that people with lived experience would agree with them. And then they engage people with lived experience and they find out, oh, it's actually different. There was one around rheumatoid arthritis, and researchers were convinced that pain management was the most important thing. And then after engaging, they found out number one was actually fatigue. And how do I go about my daily life and raise children and do all those things I want to do when I'm struggling with fatigue. And so from there, they redesigned their research project to help shape and clarify research questions so that they reflect the needs and concerns of people with lived experience. This is an important one as well. We've seen before in healthcare projects that engage people with lived experience, even around the research question, um, the changes that can be made. Sometimes there was one project that we did around mental health where people with lived experience really didn't like the kind of deficit based way the question was being asked, and it was very much the research question was very much concentrated on moving away from mental illness instead of moving towards health and well-being. And so they recrafted it to be a more strengths based question perspective in the way that they were going to look at the research project. And from there, that can impact even um, the number of participants who might want to get engaged in the project because they may relate more to the question that you're asking or the direction that you're looking at. The research methods, I know a lot of people mention that part and how important it is to engage people in the research methods and the designs that you choose. We've had ones where I think there was a project on chronic pain, and they had the research team had created a very lengthy survey that was going to be administered over the telephone. And once they started engaging with people with lived experience, they realized they needed something much more short and also self-paced. And from that, they were able to recruit far more participants because it was designed in a way that actually helped. It actually was done in a way that would help people with lived and living experience to participate. To help ensure research uses outcomes that have true meaning to the lives of patients, caregivers, families, and communities. We've definitely seen this one many times where I think we did a project or a clinical trial around knee replacement surgery. And the outcomes had a lot of the outcomes the researchers had definitely people with lived experience agreed, but there were a few that they hadn't thought of. One of them, sorry about that, one of them being caregiver burden. That was a huge concern of people undergoing treatment, and also loss of wages. And so from those conversations, researchers found surveys to add into their package that included things around socioeconomic status and caregiver burden, and so that they could measure that as well in the research project. Then, to help ensure that the language and content of the information that's being provided to participants in a study, so questionnaires, patient participant pamphlets, consent forms are appropriate and accessible. And we've seen this time and time again where simple changes to the information that's being shared with participants, or changes even to the consent form to make sure that it's a truly informed consent that you're getting, have made huge differences in the number of participants that researchers have been able to recruit once they've engaged people with lived experience. And then, of course, as I was saying, to help increase participation in a research study by making sure that the research is appropriate and acceptable to potential participants, improving the information that's being provided so that they can make informed decisions, and helping to include voices that may traditionally less be heard in research. And these are all super important. And we've seen time and time again. There was actually quite a few years ago a study, I think, where there were two clinical trials running alongside each other, and one engaged people with lived experience and one didn't. And the one that didn't have patient partners actually cost something like $1 million more than the one with patient partners, because they made sure that the recruitment strategy, the design was done in such a way that they were able to easily recruit participants. Whereas the one that didn't include people with lived experience had to keep going back to the ethics board to change their recruitment strategy because they were having difficulty recruiting. So it shows the importance of engaging. Then conducting data collection is another way that people with lived and living experience can be involved. We've had patient partners co-facilitate focus groups or co-interview peers, and it has shown a more rich, in-depth collection of data as well. And then the interpretation of research findings from the perspective of people with lived and living experience, that can inform recommendations. We had a project around administrative data, and we were going to just present, here's the numbers, here's the findings from the project, but instead we ended up doing a storytelling method, which we talked about what story does the numbers tell us, what story does it resonate with your own lived and living experience, what story is not being told, and from there we were able to understand the context in which the findings exist, but also some of the limitations of the findings and new directions to research next. And this is a reminder for our quantitative folks, because sometimes we think that engagement is more for qualitative, but it's also for quantitative research too. This comes from an amazing book by Walter and Anderson called Indigenous Statistics, a Quantitative Research Methodology. And the quote that they have is, "Statistics are powerful persuaders. As systematically collected numerical facts, they do much more than summarize reality in numbers. They also interpret reality and influence the way we understand society. The researchers who create statistics leave their mark on them, not just because people are biased in overt or conscious ways, but also because social, cultural, economic, and political perspectives infuse the research data, even when we think we are just counting people." And so that's always a good reminder of the importance of engaging people with lived and living experience, even in quantitative research, where we may think that we're unbiased and we're just looking at numbers, but oftentimes people with lived and living experience can really help to inform the context in which these numbers exist, some of the biases that maybe exist, and also what's not being counted or looked at as well. Of course, also to help co-develop ways to share and implement research findings with patients. There's been a number of times where we've had projects where at the knowledge translation phase, it's kind of, well, we could create a patient brochure, but then when you talk to people with lived and living experience, maybe it's a video, maybe it's another way to reach people with lived experience in a better way. So, and then to identify a wider set of research topics or new areas of research. The number of times where researchers have begun to engage people with lived experience and then developed an entire new area of research just by having conversations. I think there was a researcher who was looking at sepsis, and he had never considered the outcome of frailty as being important to patient partners or people who survive sepsis. And just by simply having conversations around research, realized that there was a whole other area to explore with partners. And of course, the biggest one is to help ensure that research actually reflects the concerns and the interests and the values of the public as well, since money and resources are used efficiently. So there's so many reasons why to engage. You might, as you start your journey in patient engagement, you probably will hear about levels of engagement, from consultation, which is seen as kind of the lowest level of engagement, and that's where we're obtaining input and feedback from patients about different decisions in the research process, but researchers are still kind of holding the final decision making power. And as we move along to collaboration, and collaboration is where we're actively partnering with people with lived experience. And this is really what we mean when we talk about engagement. We're actively engaging and we're doing shared decision making. So we're going to use participatory approaches that help us make shared decisions together. And then there's patient or public or community directed. Sometimes we even call it user directed. This is the most kind of exciting one where people with lived and living experience actually actively control, direct, and manage the research process. There have been community engagement activities where the community actually holds the research funding and directs the research process. And this is where the researcher or healthcare professional who's directing the project, or who's involved in the project, they bring their expertise. So they bring the expertise and community direct and manage how the project will go, and may say, oh, we need some assistance with a scoping review, or we need kind of your experience in this area. And so it's truly community driven. And what you'll see is, over as you increase the amount of so as you move up the levels of engagement, uh, there's more and more participatory approaches that you can use to actively engage people. And so some of the tools and resources that are available. Oh, Mary Ann, we got to add your picture on here. Mary Ann's new jersey. But we have a little patient and public engagement team with Ogai there. Dr. Kate Sipley, who is our director of knowledge translation. That's me in the middle. And we got Mary Ann too, who's with us. We also have this lovely monthly lunchtime learning series, and it's typically every second Wednesday of the month, except this one and October are different timing, just because of activities going on. But from month to month, you may get some case studies or some guest speakers and some different topics that can be of interest. We offer 1-hour consults for research teams if they ever just need to talk about ideas and help in the design of an engagement strategy. We also have a blog called Knowledge Nudge that has over 30 posts about patient engagement online. So it's always a great one. And we can send out these PowerPoints to everyone who attends today and some of the links so that you'll have access to these. We also have a really cool budget builder that helps you create a comprehensive, inclusive budget for engagement. And we worked with community organizations to make sure that we were including every kind of possible thing that should be thought about when building a budget for engagement. Our methods of engagement booklet. It's a PDF booklet, and it helps you look at we ended up process mapping every phase and stage of the research process, and then every level of engagement. And in those levels of engagement, what different participatory approaches you might want to use. Our readiness to engage workbook is actually based on some of our trauma-informed and intersectional analysis work that we've done. And it has questions for all research team members, including patient partners, including healthcare professionals and stakeholders. First, there's some questions to ask individually, so some critical reflexive practice on your own social location and how that impacts the way you're viewing the health issue that you're researching or that you're doing a project on. And then they have questions for the team as well. So how to come together, how to make places spaces more safe, and ways of approaching when we have power imbalances and we need to kind of resist and renegotiate power. We also have this lovely up-to-date counseling resource that's always online, that has free and low-cost counseling resources for those of us in Manitoba. But it's something that we definitely encourage even outside of Manitoba. When you are engaging people with lived and living experience, having some resources on hand should someone need some additional support following an engagement meeting. Um, to make sure that you have it on hand. We have this one pager about what to include in a call out for patient and public partners. So when you're starting to think about recruiting, this little one pager helps you think about all the things that you would want to put on a poster or on any type of call out for patient partners who might be interested. Then we have some of the articles, this one on trauma informed that has some great questions for research teams in it. And then this one, the validating a trauma-informed intersectional framework, that really helps. That brings the framework and kind of the different core components together that people can look at. And then we also have a survey of Manitoba perspectives. Oh, and we have the prep award as well, but we somehow I do not have the prep award. Oh, the prep award is also for Manitoba health researchers that's preparing for research by engaging patient and public partners. It's run once a year, and it's a little bit of funding that health researchers, students, and community organizations can apply for to help engage at the very, very early stages of the research process. And stay tuned for an announcement about that. And I guess I'll open it to questions. Sorry, that was a lot of information.
Carolyn, you have one on the chat. It says, can you share an example of the fourth level of engagement you mentioned when the community drives the research?
The community driven ones, those are even though they're rare, they're amazing when they do happen. I would say there are some good examples within Indigenous health research, especially if you look at OCAP principles around Indigenous health, everything, ownership of the data, all of those elements are controlled by community. And we've had other research projects where we've had community organizations who manage who manage the entire research and identify what research area they want to. They hold the funding, and then they really kind of direct researchers to what they want to look at. And researchers will give advice on, you might want to consider this method, or should we do this? But really, it's ongoing. All the major decision making always goes back to the community that you're engaging, or the community organization that you're involved in. And I feel like there's been some successful ones. I will definitely perhaps send Louise and send all of you some examples of ones where we've seen the highest level of community participatory research action, because that's a really good question. I want to make sure you have some good examples of that.
One
So
example that comes to my mind is Studio Central that was developed by a family, and he had schizophrenia. And so they wanted to create a resource. So what they did was the family got the funding, so they held the power, and the researchers were alongside them, but more so as a go-to, where when it came to sharing information, what are some qualitative methods they could use. So the researcher was more of a tool for the folks on the ground, but they had the control to choose and really lead. And so from that came the development of Studio Central, which is an arts-based facility for folks with mental health that was missing. So I think there are some really cool local ones. I can't think of on top of my head, but Studio Central and Artbeat Studios
that,
is one that came out from the research. Yeah.
that's a really interesting one. Thanks for sharing that, Ogai. Were there other questions? I know it's a lot to take in, so it's okay. There's no pressure to come with the questions. You definitely know where to come, or you can always send us an email if one comes up later on. Definitely don't hesitate. So maybe, oh, thanks for this. Oh, thank you so much for attending. I'll announce our next session. I'm sorry it's me again. We'll try to get somebody else now. The next session is actually going to be held during, oh yes, absolutely. We can send the recording out to everyone. The next session is going to be held during Patient Safety Week. And so it's going to be Wednesday, October 25th. And we're going to talk about the importance of trauma-informed engagement. So we talked a little bit about it today, but we're going to go in depth about what that looks like, what types of things you can do to make sure that your engagement strategy is trauma-informed, and things that you need to think through as you develop your engagement strategy. In the meantime, never hesitate to contact us if you have any questions. And we look forward to seeing everyone at our next session. Thank you so much. Yes, and we will send out an email with the link to the recording and everything, and some of those examples as well. Wonderful.
Thank you.
Thank you so much for attending.
Thanks so much, Carolyn. That was very informative.
Thank you for attending. Is it just us now?
Yes.
Oh, we should stop recording.
Yes. Thank you so much. Stop recording.
Oh.